Hello everyone and welcome back. In today's teaching, we are going to be considering the anatomy of the stomach. And the stomach is a J-shaped intraperitoneal muscular organ that forms the dilated parts of the gastrointestinal tract between the esophagus and the duodenum. And by intraperitoneum, we mean that it is almost covered by peritoneum. And from this diagram, you can see that the shape is J in shape. And also, from the definition, we said that it is in between the esophagus and the duodenum. So that means the stomach is in between the esophagus superiorly and the duodenum inferiorly. So let's talk about some basic anatomical facts about the stomach. Number one, we say it is J-shaped, right? It is in between the esophagus and the duodenum. And also, it is located in the epigastric and left hypochondriac region. If you've not checked the video where we divided the abdomen into 9 regions, please do well to check that. Now, what is the function of the stomach? The stomach is responsible for storage, for mixing, and for digestion of food. So having said that, let's go straight to talk about parts of the stomach. The stomach is divided into 4 parts. From this diagram, the first part is the cardia. This part is the cardia, and this cardia surrounds the opening of the esophagus into the stomach. This cardia aspect surrounds the opening of the esophagus into the stomach. The second part is the fundus of the stomach. Now, this fundus part is the area above the level of the cardiac orifice. This fundus is that area that is above the cardiac orifice. Then the body, this part, the body is the largest portion of the stomach, while the pyloric part is the most distal portion, which is now divided into the pyloric antrum and the pyloric canal. So once again, the stomach is divided into what? The cardia, the fundus, the body, and the pyloric parts. So let's talk about the openings that can be found in the stomach. Essentially, there are 2 openings in the stomach. The first one is the gastroesophageal orifice, while the second one is the pyloric orifice. So having said that, let's move to sphincters. What are sphincters? Sphincters are control mechanism in the body, and in the stomach we can find 2. First one is the cardiac sphincter, while the second one is a pyloric sphincter. That is this cardiac sphincter that prevents backflow of the gastric contents into the esophagus, while the pyloric sphincter controls the backflow of contents from the duodenum into the stomach. So let's move to the curvatures of the stomach. Essentially, we have 2 curvatures. We have the lesser curvature and we have the greater curvature. The lesser curvature and the greater curvature. Now, here is the lesser curvature here. The lesser curvature is right. It's on the right side and it's concave. And the left side as the greater curvature, houses the greater curvature. So the lesser curvature is right and concave, while the greater curvature is left and convex. Now, it is very, very important to note that this lesser curvature is related to the lesser omentum, while this is related to the greater omentum. That is in relation to the peritoneum. Anyway, so now let's talk about the surfaces of the stomach. It has 2 surfaces essentially: the anterior superior surface and the posterior inferior surface. So once again, it has 2 openings, it has 2 sphincters, it has 2 curvatures, 2 surfaces, and 4 parts. So let's now discuss the relations of the stomach. Now, anteriorly, it is related to the left lobe of liver, also to the diaphragm, and also to the anterior abdominal wall. While the posterior relation, they are the structures that make up the stomach bed, and they are displaying the pancreas, the left kidney, and the transverse mesocolon. Now let's move straight to discuss the basic histology, something very, very basic anyway. So histologically, there are different layers you can find in the stomach. The first one is the mucosal layer, the second one is the submucosal layer, the next one is the muscularis external, then you have the serosa. And from this diagram, this part labeled points, they are the gastric pits. Then we have the simple columnar epithelium, also in the mucosa. Also can find the gastric glands. Now in the submucosa, you can find the submucosal plexus. And in the muscular external layer, you can find the oblique layer, the circular layer, the longitudinal layer, and the mesenteric plexus. Now, having discussed that, let's go straight to discuss the blood supply to the stomach. The blood supply to the stomach. Now, the stomach is supplied by the right gastric artery here, and also by the left gastric artery, by the right epiploic artery, and also by the left gastroepiploic artery, as well as the short gastric arteries. Now, to the venous drainage, we have the left gastric vein, the right gastric vein, short gastric vein, the left gastroepiploic, and the right gastroepiploic vein. Now let's go to the clinical anatomy. What can go wrong? What can go wrong? The first one is we have the peptic ulcer disease, which is also the ulceration of the stomach due to acid peptic injury. We also have gastric carcinoma, which is a tumor, a malignant tumor of the stomach. And we also have what we call gastritis, which is the inflammation of the stomach lining. So I believe that with this, you understand the basic anatomy of the stomach. And if you have any questions, do well to draw them in the comment section. Thank you, and see you in the next class.